Question 121. Which of the following are examples of a health restoration activity? Select all that apply. A. Administering an antibiotic every day. B. Teaching the importance of hand washing. C. Assessing a client's surgical incision. D. Advising a woman to get an annual mammogram after age 50 years. Answer A. Explanation. Health restoration activities help an ill client return to health. This would include taking an antibiotic every day and assessing a client's surgical incision. Hand washing and mammograms both involved healthy people who are trying to prevent illness. Question 122. Which of the following aspects of nursing is essential to defining it as both a profession and a discipline? A. Established standards of care. B. Professional organizations. C. Practice supported by scientific research. D. Activities determined by scope of practice. Answer C. Explanation. The American Nurses Association, ANA, has developed standards of care, but they are unrelated to defining nursing as a profession or discipline. Having professional organizations is not included in accepted characteristics of either a profession or a discipline. A profession must have knowledge that is based on technical and scientific knowledge. The theoretical knowledge of a discipline must be based on research, so both are scientifically based. Having a scope of practice is not included in accepted characteristics of either a profession or a discipline. Question 123. The charge nurse on the medical surgical floor assigns vital signs to the nursing assistive personnel (NAP) and medication administration to the licensed vocational nurse (LVN). Which nursing model of care is this floor following? A. Team nursing. B. Case method nursing. C. Functional nursing. D. Primary nursing. Answer C. Explanation. With team nursing, an RN or LVN is paired with an NAP. The pair is then assigned to render care for a group of patients. In case method nursing, one nurse cares for one patient during her entire shift. Private duty nursing is an example of this care model. This medical surgical floor is following the functional nursing model of care, in which care is partitioned and assigned to a staff member with the appropriate skills. For example, the NAP is assigned vital signs and the LVN is assigned medication administration. When the primary nursing model is utilized, one nurse manages care for a group of patients 24 hours a day, even though others provide care during part of the day. Question 124. Paul Jake suffered a stroke and has difficulty swallowing. Which healthcare team member should be consulted to assess the patient's risk for aspiration? A. Respiratory therapist. B. Occupational therapist. C. Dentist. D. Speech therapist. Answer D. Explanation. Respiratory therapists provide care for patients with respiratory disorders. Occupational therapists help patients regain function and independence. Dentists diagnose and treat dental disorders. Speech and language therapists provide assistance to clients experiencing swallowing and speech disturbances. They assess the risk for aspiration and recommend a treatment plan to reduce the risk. Question 125. Which of the following are examples of theoretical knowledge? Select all that apply. A. Antibiotics are ineffective in treating viral infections. B. When you take a patient's blood pressure, the patient's arm should be at heart level. C. In Maslow's framework, physical needs are most basic. D. When drawing medication out of a vial, inject air into the vial first. Answer A and C. Explanation. Theoretical knowledge consists of research findings. Facts, for example, antibiotics are ineffective, is a fact. Principles and theories, for example, in Maslow's framework, in a statement from theory. Instructions for taking a blood pressure and withdrawing medications are examples of practical knowledge, what to do and how to do it. Question 126. The nurse organizes that urinary elimination changes may occur even in healthy older adults because of which of the following? A. The bladder distends and its capacity increases. B. Older adults ignore the need to void. C. Urine becomes more concentrated. D. The amount of urine retained after voiding increases. Answer D. Explanation. The capacity of the bladder may decrease with age, but the muscle is weaker and can cause urine to be retained. Older adults don't ignore the urge to avoid and may have difficulty getting to the toilet in time. The kidney becomes less able to concentrate urine with age. Question 127. During assessment of the client with urinary incontinence, the nurse is most likely to assess for which of the following? Select all that apply. A. Perineal skin irritation. B. Fluid intake of less than 1005 milliliters per day. C. History of antihistamine intake. D. Headaches of UTI. E. A fecal impaction. Answer A, B, D, and E. Explanation. The perineum may become irritated by the frequent contact with urine. Normal fluid intake is at least 1,500 millimeters, and clients often decrease their intake to try to minimize urine leakage. UTIs can contribute to incontinence. A fecal impaction can compress the urethra, which results in SMIs of urine leakage. Antihistamines can cause urinary retention rather than urinary incontinence. Question 128. Which action represents the appropriate nursing management of a client wearing a condom catheter? A. Ensure that the tip of the penis fits snugly against the end of the condom. B. Check the penis for adequate circulation 30 minutes after applying. C. Change the condom every 8 hours. D. Tape the collecting tube to the lower abdomen. Answer B. Explanation. The penis and condom should be checked half-hour after application to ensure that it's not too tight. A1 in space should be left by the way the penis and the end of the condom. The condom is changed every 24 hours, and the tubing is taped to the leg or attached to the leg bag. An indwelling catheter is taped to the lower abdomen or upper thigh. Question 129. The catheter slips into the vagina during a straight catheterization of a female client. The nurse does which action? A. Leaves the catheter in place and gets a new sterile catheter. B. Leaves the catheter in place and asks another nurse to attempt the procedure. C. Removes the catheter and redirects it to the urinary meatus. D. Removes the catheter, wipes it with a sterile gauze, and redirects it to the urinary meatus. Answer A. Explanation. The catheter in the vagina is contaminated and can't be reused. If left in place, it may help avoid mistaking the vaginal opening for the urinary meatus. A single failure to catheterize the meatus doesn't indicate that another nurse is needed, although sometimes a second nurse can assist in visualization of the meatus. Question 130. Which statement indicates a need for further teaching of a home care client with a long-term indwelling catheter? A. I will keep the collecting bag below the level of the bladder at all times. B. Intake of cranberry juice may help decrease the risk of infection. C. Soaking in a warm tub bath may ease the irritation associated with the catheter. D. I should use clean tech when emptying the collecting bag. Answer C. Explanation. Soaking in a bathtub can increase the risk of exposure to bacteria. The bag should be below the level of the bladder to promote proper drainage. Intake of cranberry juice creates an environment non-conducive to infection. Clean technique is appropriate for touching the exterior portions of the system.
Thank you for watching.